Hello, my name is Lisa Hamadou, and I will be doing a presentation on acupuncture. So, acupuncture originated from China 5,000 years ago, and it was created to prevent medical conditions that people were experiencing at the time. So, the procedure of acupuncture is to place needles along precise locations of the body. So, these needles were originally created with gold, silver, bamboo, stone, and bones at the time. Now, as you know, using such foreign objects, introducing them into the body puts a risk for contamination and infection, as these materials being used were not sanitary. So the bronze statue on the right side of the screen was created in the 15th century to show acupuncturists or people who were learning to do acupuncture points in the body in which the needles can be placed in. And acupuncture theory says that everybody has a chi flow, an energy flow within their body, and it helps to channel and create balance and health within them. And this chi or body energy flow is where the needles for acupuncture should be placed. Now, a book called The Great Compendium of Acupuncture Moxibustion was published with the principles of acupuncture on which modern practices of the tradition were used. Now, this book was created between the 14th and 16th centuries by the Ming Dynasty. That was when it was flourishing, and the book basically just has 365 points in which needles can be placed, and these needles follow the flow of qi, and they help you to either move it or maintain it. Now, the Thousand Golden Remedies by Sun Ji Miao is the first book ever to show a clear chart of where the needles should be placed. And these needles, the book showed the front, side, and back views of the body. So essentially, the book was able to encase all 365 points. And surprisingly, the interest of acupuncture in China declined in the 17th century because people thought it was superstitious and it was irrational. They thought that sticking needles in someone's body wasn't really going to help them prevent against medical conditions or make them feel any better if that was the case. It was eventually outlawed in China in 1929, but then reinstated in 1949 when the communist government arose. So from then on, it just became very popular. In 1972, President Nixon visited China. He also had a reporter that had gone with him, and the reporter had previously gone an appendectomy. So after the appendectomy, he went with President Nixon to China, and he was experiencing great pain after the procedure, and so he decided to undergo acupuncture. So when he underwent the acupuncture, he said that he had a great pain relief, and he came back to the U.S. and wrote about it, and from then on, acupuncture just became very popular in the U.S. Now, another culture that also has been using acupuncture is the French. Georges Silo de Morant, he encouraged French doctors to use acupuncture after visiting China in the 1800s. There, he was able to learn about acupuncture and then go back to France and teach other physicians how to perform acupuncture. It was taught from 1943. Beginning in 1943 in many different private schools across the country, and eventually it became a degree in France, and the degree is now known as the National Capacity Diploma for Acupuncture, which was created in 2007. And now acupuncture is used for treatment purposes by doctors only in France. So acupuncture is used as a treatment for a variety of things. So first, you begin with a needle, which is very thin. It's thread-like, it's the size of 2 human hairs, and it's made from stainless steel. They're disposable, so there's no risk for contamination or infections, and they're very sanitary. One needle should be only used for one person at a time, just to avoid cross-contamination. The needles are inserted depending on how big the patient is, how old they are, what they're using it for, and what condition that they are wanting to treat. So as we discussed, the chi flow, the body flow, the energy flow is important to also keep in mind when doing the treatment on someone, because you want to divert it or maintain it the same depending on the condition that they're experiencing. And the needle is usually inserted 3 to 4 inches into the point. And in China and in the Western Hemisphere, it is It can also be used as an anesthetic, and it has been used for knee pain, headaches, both migraines and tension headaches, neck pain and back pain. It's also been used for dental pain, usually after your wisdom teeth are removed, labor pain, women who are going through pregnancies, but it can also be used for osteoarthritis, menstrual cramps, respiratory disorders such as asthma, allergic rhinitis. It can also be used for emotional disorders such as anxiety and depression, and then digestive problems. It can be used for IBS and vomiting and nausea. And if you're having any pain syndromes such as rheumatoid arthritis, and it can also be used for fatigue and people who are addicted to opioids or even alcohol. So acupuncture cannot be used on anyone with with any hemophiliacs, because when you stick someone with a needle, they do have tendencies to bleed, and hemophiliacs, as we know, do not have the factors in their blood to clot their blood in order to stop them from bleeding. So anyone with any type of clotting disorder is not recommended to use acupuncture as a treatment, and anyone who's also taking a blood thinner is not advised to also undergo a treatment of acupuncture, just because their blood is so thin and they'll bleed out fast if they're sticked in the wrong place, or if anything. And women who are pregnant are not advised to use big needles. Those who cannot control their movements, such as those with ADHD, Tourette's, epilepsy conditions, or Parkinson's, just because they move so much and their movements can cause the needles being placed in places that they're not supposed to be, or them moving while they are in place. And then areas of recent incision, scars, keloids, or anyone with a poor skin condition, because again, they might not be able to pinpoint where these needles can go into. And stroke patients, just because they don't want them to experience a stroke while going under acupuncture. Many people do not report any side effects after a treatment of acupuncture. Most people report feeling much better, but when they do, it's usually bruising or bleeding or soreness around the injection site. Sometimes they're very tired from the procedure, just from laying there for so long. Again, being sore from laying there so long. Their muscles twitch from the needles being placed within the muscles. Lightheadedness, again, that's from laying down for so long. And an emotional release, as I said, it's used for emotional disorders. So from there, people start to feel better about their conditions. Now, for people to learn acupuncture, there are schooling for people that would like to practice, but many people believe that it should only be taught to doctors, just because they have the full extent of the body, the full knowledge of the human body. And if you want to learn it in the U.S., you can, but the test is done by the so you get the license. The license is issued by the state, and the test is administered by the National Certification Commission for Acupuncture and Oriental Medicine. It can also be practiced by Oriental medicine doctors, known as OMDs. OMDs would usually have to go 200 to 300 hours of studying, and then from there they should be practicing acupuncture for 2 years. They have to have passed the board certification and performed at least 500 acupuncture treatments. And for OMDs, the current school for them to go to is the American Academy of Medical Acupuncture in El Segundo, which is in California. And also, if you want to go to school to be an OMD, you do need an associate degree before you go, so you don't have to have a bachelor's. And I think the GPA minimum is a 2.5, and schooling usually takes 3 years. It can take 4 years if you want a degree in traditional Chinese medicine and herbology. So a study was done in determining the relationship between acupuncture and its benefits. The article was called "Does the Effect of Acupuncture Depend on Needling Sensation and Manipulation?" Now, the researchers in this study wanted to, like I said, understand the relationship between acupuncture and its benefits. So they took 115 participants that underwent an acupuncture treatment, and they all did it in the left leg, just to have, standardization between the treatment and the patients. So the p-value that came out from this study was 0.013, which is significant. So, in other words, the relationship between acupuncture and its benefits, feeling better, was positive, and no one that participated in this study reported any side effects, and they all reported feeling much better after their acupuncture treatments. So it's safe to say that acupuncture is a beneficial procedure and should be used more often in treatments along with preventative measures.